Dickmeyer and Rhonda Moats. Sorry about that, Rhonda. With us today to talk about medical insurance, trends, challenges, some possible solutions, and figure out how can we navigate this. I know this is a big issue for so many organizations. So with that, I'm going to turn it over to Corey and Rhonda.
Thanks, Ann. Good to be with all of you. I apologize in advance for my cold. I'm a little raspy today, but we'll get through it okay. So with that, I'm going to share my screen, and I do have a PowerPoint slides to share with you all. Everybody see that okay? Okay. Well, again, thank you, Ann, for the introduction. And again, I'm Corey Dickmeyer with FNIC, formerly the Harry A. Koch Company, for those of you who may be familiar with that name. In 2020, we went through some reorganization and had a name change. We've actually been owned by First National Bank, or the Lordson Corporation, which owns First National Bank since 2004. So not a new change, but definitely a new name starting in 2020. And so hopefully you're starting to recognize that the new name out there in the marketplace. But and then I have Rhonda Moats with me.
Hello.
Rhonda works with a lot of our larger nonprofits and is an account executive on our team. Has just a tremendous history with working with HR, and so wanted to include her in the discussion today as well. But for the purpose of the meeting, hopefully we can bring some insights to you all, some things that we're seeing in the marketplace in 2023, and some of the challenges, as Ann pointed out, as well as provide you with some updates on the program through the Nonprofit Association of the Midlands. So we'll certainly highlight that, provide you with some new things we're seeing in the marketplace as well, and provide you with some options that you might consider moving forward. With that, I'll jump into the slides and some of those trends that we are seeing. Obviously not new information to most of us that inflation has been problematic over the last year to 2 years here, and continues to have some impacts on healthcare. Of course, healthcare costs do tend to lag normal inflation, and so with that, we're seeing or we're projecting to see larger rate increases in the marketplace from our carrier partners. Adding to some of that concern are the prescription drug costs that we continue to see soar with new drugs coming into the marketplace. Specialty medications have been a thing for quite a while, and some of those higher cost medications in the marketplace have been part of the rising healthcare cost or rising pharmacy costs. But now we're starting to see some of these biosimilar medications come out into the marketplace as well. A biosimilar is essentially a generic medication for these specialty medications. So the good news is we're starting to see more of these medications hit the shelves out there. The tougher news is that they're not moving the needle quite as effectively as sort of your traditional generic medications in the market. And so the spread in pricing that we're seeing isn't quite there. But it does continue to be quite a new batch of these medications hitting the streets all the time. And that's having a huge impact on pharmacy spend and healthcare costs overall. As we look at coming up here in May, some of the COVID-19 emergency will effectively end, as President Biden issued just this last week. And some of the things that will end with that are the coverage associated at least out of network for vaccinations. And so on an out of network basis, those vaccines may cost up to $130 per fill or per vaccine. In network, those vaccines will still be covered. The cost of testing will not be available on an out of network basis. We are seeing trends that some of the COVID claims are starting to decrease, and expecting to see that decrease in the 4 to 5% range within our claims spend. So those are some of the trends we're seeing on the COVID front. Of course, all of these things make it more difficult for our employer groups to attract and retain good employees, and with that, also we continue to see more or the trend of work from home and virtual work continue. Although some of our larger organizations are starting to require employees come back to the workforce. We of course have a little bit of a hybrid model even within our own place of work. And so certain industries will continue to lean heavily on employment from a virtual on a virtual basis, and others are starting to ask employees to return to the workplace. Another trend that we're seeing just with regards to the high cost, and perhaps as an offshoot of that, is an expansion into the voluntary or the employee paid benefit space. So traditionally, there have been a few carriers in that space, the Aflacs or Colonials of the world that offer these worksite plans, but now a much broader group of carriers are starting to participate in that voluntary space. And so we do continue to see employers looking to those types of benefits to attract and fill out or round out their employee benefit program. So types of coverage that might be included in that are different flavors of life insurance, accident and sickness benefits, hospital indemnity type plans, critical illness policies would fall into that space where we're seeing some of that expansion in the market. Some options for employers to consider. Of course, the Affordable Care Act came into full swing back in 2010 to 2014. And so small employers, those with fewer than 50 employees, have the Affordable Care Act pools or small group plans to consider. Just pointing out in that first bullet that there is no requirement for those smaller employers, less than 50 employees, to offer health insurance. Of course, we all want to attract and retain the best and brightest talent we possibly can. And so it's certainly an important benefit that employers are looking for, but we're just merely pointing out that unlike your larger employer counterparts, those with 51 and above, there is technically no requirement to offer health insurance coverage like those larger employers who may be faced with very stiff penalties if they're not offering health insurance under the Affordable Care Act rules and requirements. In that small group space, we really have three or four primary carriers in Nebraska. United Healthcare, Blue Cross Blue Shield, Medica, and Aetna on a very small scale offer plans in that ACA plan scape. And so we've got plans that are metallic in nature, gold, silver, and bronze level plans that are primarily age-based, that are guaranteed issue products that smaller employers may gain access to based on the age attained rates that are offered in with those various carriers. So again, those rules apply. There are participation rules that apply. for those smaller groups. Generally 50% of the eligible employee population would be required to participate in order for the carrier to offer those plans. That participation rule generally does not include valid waivers. So those folks on your plans that may waive coverage due to having other coverage, valid insurance through a spouse or parent's plan. Also, as far as TRICARE or other military based plans, Medicare as well would fall into that category. But otherwise, those participation requirements still apply. But otherwise, the plans are guaranteed issue to those small employers. So the rates again are based on the attained age of the employee and all of the dependents covered under that plan within those various models, the gold, silver, and bronze style plans. We are seeing continued growth into these high performance networks. And so some of you may be familiar with the high performance networks here in Nebraska, affiliated with CHI hospitals and doctor networks, as well as the Nebraska Health Network, which encompasses Methodist Hospital, university hospitals and doctors, into more of a narrow network or narrow panel of providers. Some of the carriers have formed contracts with these panels to help some steerage to those providers, and will offer some discounts to help control costs for the employer to offer a plan that's solely aligned with those performing networks. And so in that, you might see a discount anywhere from 9 to 20%, depending on the affiliation with those provider networks. And so we continue to see groups migrate into those types of offerings, but we do in the nonprofits still see quite a few offering a broad level network as well. Across the board, some that are offering a multifaceted approach with the broad network, as well as some of those narrow network offerings, again, to control costs. Level funding is a concept that's been in play for a few years as well. Level funding is a self-insured product, generally tailored to those small groups. There are some carriers that will go upstream up to 300 employee lives, but most of the level funded products that we see are tailored to groups under 100 lives or even under 50 lives. For example, Aetna's product is in that 50 and under marketplace. Blue Cross Blue Shield as well generally plays in the 50 and under space, but it's a self-funded product that really looks, acts, and feels like fully insured, in that the pricing for each employer is set. The premiums are set for each month. So you know what your maximum exposure is for the year. There is a level of renewal risk involved in that should your claims be a little higher, obviously they can pass on a little larger rate increase in that market, but you also share in some of the benefit as well. So if you have a good claims year, they will pay back a dividend. The carrier will pay back a dividend to those well-performing groups that have good claims experience. And so there is that opportunity or that upside for some premiums to be returned to the group in those good claim years. So level funding has been a popular trend in the last few years, and we've definitely seen a migration from some of the fully insured pools for groups that can qualify. That's the difference really with the self-funding, is that the carriers can underwrite those groups, unlike the Affordable Care Act small group plans. There is a level of underwriting or qualification that must be completed by the groups in order to qualify for that level funded product. But those that can and do oftentimes will see a discount or a better priced premium in that particular space. Lastly, we oftentimes with some of our smaller groups or startups even will have a question about stipends, and whether those are continue to be used as a strategy for offering healthcare to a new employee or an executive director. We certainly have those questions come up all the time. The reality is with the stipend, generally it's a payroll subsidy, so it's an after-tax benefit. There's not a real great way to structure that true stipend unless it's an after-tax type of arrangement. There is a concept called ICHRA, or this individual coverage health reimbursement, that came out in 2020 that allows employers on a pre-tax basis to reimburse the individual coverage that's purchased by their employees in the marketplace. There are certain rules that apply, and there needs to be a formal plan document, the ICHRA plan, that is set up and administered by the employer, but it works in conjunction with those employees that are purchasing individual coverage out there. There is still an offset for the tax credits, and so for small employers under 50 lives that may offer an ICHRA plan, and they have employees that go out and receive tax subsidies through healthcare.gov, those tax subsidies offset the benefit of the ICHRA under that structure. So there is some play with regards to the tax credits in that marketplace. But those certainly have gained traction in other states. Other states tend to have a little bit more competitive individual market than the state of Nebraska. We really only have a couple carriers that are participating in the individual coverage marketplace. Blue Cross Blue Shield did re-enter that marketplace in 2023. Primarily before that, Medica was the sole player in that individual marketplace, and so we just haven't seen the adoption of that ICHRA concept with regards to the individual coverage marketplace. Want to touch now on the NAM benefit connection, or the NAM pooled product that we helped establish back in 2003. So we've had a almost 20-year relationship with NAM, and we set this plan up. Initially, there was about 16 adopting employers that came into the pool back in 2003. We were fully insured at the time. And of course, in 2010, as I mentioned, the Affordable Care Act came into full swing. And so we had to look for an alternative to how we pooled those groups within the NAM benefit connection. And so we started the level funded plans that I mentioned on our last slide, as well as a self-insured option for some of our larger employers that pools members at renewal and helps drive down the cost or the fixed costs associated with healthcare by pooling those groups together and managing that as one large block of business. Blue Cross Blue Shield became our partner in 2022. Again, that pools all of those members for renewals. We have employers with that have 5 or more enrolled are eligible for those level funded products. And so again, the 1 to 5 life groups, we would still have the Affordable Care Act plans for. For those groups 5 or more, we have this NAM benefit connection. The idea of the connection is we also provide a benefits administrative platform that runs alongside it. And that's a tool, an electronic interface tool that your team can use to help with really pulling all of the benefits together. Medical, dental, vision, life, disability can all be administered through that online platform. that we offer the groups in conjunction with this program. And so all of your ads, terms, open enrollment can be handled through that system. We partnered with a company called Employee Navigator starting at the beginning of this year. And so we're starting to migrate all those groups over to Employee Navigator as we move forward. But a very effective tool just to help you streamline some of the job that goes along with administering your health plan. As I mentioned, it is a level funded plan with Blue Cross Blue Shield. So there is a qualification process that we go through, an underwriting process to qualify. But the groups that do qualify have enjoyed a long track record of success. We generally see our renewals in the low to mid single digits. Last year in 2022, we had a 7% rate increase that we shared along with our members. 5, 6, 7% has been pretty much the track record since I started with the company back in 2004. And so while we hate to deliver rate increases on an annual basis, when we can manage that spend and keep those rate increases manageable for our employer groups, we feel like we're offering a good long-term stable option to the nonprofits out there. Those plans include HSA, HRA, and FSA concepts as well. So we can bundle or include those tax favored accounts as well within our plan designs. We have 4 or 5 PPO plan designs, so some sort of your traditional copay plans, as well as your qualified high deductible HSA style plans that are included in our menu of plan design options with Blue Cross Blue Shield. As I mentioned, with regard to the connection, we do offer the level funded plans for the smaller groups. Generally, those fit for employers 5 to 100 lives. They are dividend eligible, and the larger employers can have the opportunity to take advantage of more of a true self-funded type of an approach where you're purchasing stop loss. The stop loss coverage is pooled together, or we essentially purchase that together to help lower the cost to all of the groups that participate in that style of plan. So whether you're a 5 life employer group or you have 200 lives, we can approach you with the NAM benefit connection and provide solutions that would meet your needs, whether it be on a traditional self-funded basis or on the level funded side of things. Some of the highlights of the benefit connection, as I've mentioned: rate stability, pooled renewals. The profits stay within the program, and so years where we may have a tougher renewal, we can use the proceeds that we've had within the program to help buy down future renewals. As I mentioned, the compliance piece, HR management, and the Ben admin system that couples with the program is an effective tool as well. As well as employee communication through that tool and through us, your broker partner, as we support the nonprofits in that program. Some concepts that are perhaps a little newer to the marketplace. Nice Healthcare is a new provider that approached us at the beginning of this year. They're similar to the direct primary care models that you may have heard of. There's a few around town that participate in that space, and they're really recognized more as a subscription service in a sense that you provide an upfront cost for direct access to your primary care provider. The nice thing about Nice is that number one, the price point to get into it is generally much more affordable. It's about $43 for access to primary care. And it includes both telehealth style visits as well as virtual health visits, but they will also provide in-home visits as well, especially here in Nebraska. In Iowa right now, it is a telehealth only plan, but in Nebraska, they do have on-site practitioners that will come to your house. But the great thing about it is it's primary care paid for really under that subscription charge. So you pay $43 a month per employee, but your healthcare is covered on a primary basis at 100%. And that also includes over 550 pharmaceuticals as well that they will offer under their formulary list. A lot of tests, x-rays, blood work, a lot of those primary kind of low cost tests that can be performed in the comfort of your own home under that subscription visit. So this is a great way for employers to extend a low cost, affordable option to their employees that maybe otherwise don't have a great option for primary care. What we are also seeing with Nice Healthcare is some employers that are taking advantage of perhaps they're in a traditional lower deductible copay plan today, but their costs continue to rise like everybody's. And so what they're looking at from a strategy perspective is perhaps moving their employees to a higher deductible health plan, trying to drive down premiums, save some cost, and backfilling with a program like NICE. And so again, by saving some premiums on the major medical spend, you might be able to afford the NICE healthcare at a reasonable amount and provide a benefit to your employees that is tremendous. Even within the health savings account space, NICE healthcare is a fit. And so I know for my family in particular, as an example, we carry a $6,000 family deductible. We don't have any first dollar coverage for those expenses until we've met that $6,000 deductible. The only thing that is covered under our health plan is preventive care. So we could go in for a routine exam, but any type of sick care visit, we would have to pay out of pocket subject to the deductible. NICE would be an opportunity for us to have some preventative care covered under that $43 charge for those cares for those primary care type visits. So it's a new concept, but a popular one that we've been talking a lot about with employers as a way to, again, bring that primary care relationship to your employees. So important to have a primary care relationship with your providers because it really gets you in the healthcare system front and center. And I see you raise your hand.
I have to do that at least once a day, that I forget to unmute myself. A couple of questions on the NICE healthcare. Am I remembering correctly that needs to, the employee pays that? So the employer could pay the employee and then the employee would pay that directly? Is that how that works?
The employer often, well, it can be either way. So
Okay.
employer can pay for that fee or the employee. But
Okay.
generally we're seeing a lot of the employers will pick up that. The other space where this is a good fit is oftentimes we have employers that say, hey, what can we do for our part-time population or for various industries. We're seeing that there's a type of employee that maybe can't afford the major medical premium, but NICE healthcare brings them to a price point where they can at least afford that basic care and bring them into the healthcare system to cover a lot of the basic needs there.
Thank you.
Yeah.
There's also, there were a couple questions in the chat. And this ties into this, how many hours does an employee need to work to be eligible for healthcare? What constitutes that full-time? Is it like 30 hours, 28, 32 hours?
Yeah, great question. So on the major medical plan, the carriers will generally set that eligibility at 30 hours, and that's subject to the Affordable Care Act. But NICE healthcare falls outside of the insurance, so there's no eligibility provision with regard to NICE. And then Rhonda pointed out under that subscription fee, that $43, it's not just coverage for the employee. They can cover all of their family members for that $43 amount as well. So whether you're covering a spouse or a child or 9 children, they all fall under that one subscription cost.
Thank you. And then another question from the chat box. When you were talking about the more traditional medical insurance and like if you had 5 employees, that you had to have 5 to qualify, does that employees or would that include like a spouse could get you to that number 5? Yeah,
that number is pertaining to the employee count.
Okay.
So we need 5 eligible employees participating to be able to hit that number.
Thanks. That's all the questions I've seen thus far in the chat box. So sorry for the interruption, but if you have questions, throw them in the chat, and then let's learn more about individual dental and vision.
Sure. So on the individual dental and vision side, Emeritus is a partner that we've had for years on the group side of things, but they've let us know about a product that they've released into the market for individuals as well. Generally speaking, it's been unheard of to find dental and vision coverage without waiting periods for some of your more major types of care. So, you know, I could go buy an individual dental plan and I would have coverage for cleanings and some of the basic stuff. But if I wanted to have coverage for a crown or something more major, I'd have to wait at least a year before that coverage was available and actually pay my premiums into the system. Emeritus has a product now that waives those waiting periods on an individual basis. And we oftentimes have groups come to us asking, you know, we only have 1 or 2 employees. Is there something we can do? Is there a benefit we can offer? And so this was something we certainly wanted to highlight for some of the smaller groups out there that may have individuals that need dental care and would like an option like that. So certainly get in touch with us if there's questions on the individual dental or vision as well. That is all of the slides I have today, but as Ann mentioned, happy to open it up to any questions that might be out there or address anything that you have.
And we will send this recording and the slide deck out to the HR listserv, so you'll get it that way. Kimberly, Kim, Tom, from how's Hawaii? And I see your hand is raised.
It's great. You guys want to see?
Oh.
It's great.
That is nice.
I have a question, 2 questions. Traditionally, like through a health insurance plan, if you offer that as an employer, you're over the 5 or whatever the employee limit or minimum is. Can you simultaneously offer stipends for those people who have health insurance coverage, but you may want to offset maybe their costs for a health insurance that they're paying for through maybe a spouse or someone else? Is there any restrictions on that? I feel like there used to be, but I wanted to make sure that was still in place. Does that make sense?
Yeah, Rhonda, do you?
There are some rules about, and we probably need to just research to make sure they haven't changed. But there were some rules that if people waived because they were covered under another plan, if you gave them some dollars to help reimburse. I think there's some rules. And
okay.
We could get back to you on that because it's just been a little while since anybody's brought it up. And so I want to make sure we're giving you correct information.
Okay.
So we will get back to you on that.
And then for the NICE plan, so is there a minimum number of employees? I guess what stops just a general citizen from signing up for that? Or is there, if there's not a limit to the number of hours that you work, or numbers?
That's a great question, Kimberly. I don't know that they're marketing to individuals just yet. I think it's mostly at the employer group site. I don't believe they have any issue going down to 2 lives, but that's where they're marketing most of these plans through at this point.
Okay, thank you.
Sure.
I see there's another question in the chat box. Is there any plan or statutory minimum percentage of employer premium contribution? And I'm not, yeah.
Just the carrier requirement is generally that the employer is picking up 50% of the single premium. So that would be the single employee only. Many of our employers will contribute, higher amounts than that towards the single, and some that may also contribute towards the dependent share of the cost as well. But that would be the only, it's not a statutory requirement, but a carrier requirement, simply because they want to ensure that there's an employer-employee relationship, and that this is truly a benefit offering. And so that's why they put that in, as well as to avoid adverse selection, by making sure that that there is some skin in the game from the employer side of things.
Great, thank you. Any other questions, comments, thoughts? Okay, there's a question. Can they structure their plan to exclude spouses?
Yes,
Or can they be, yeah.
there are employers that are instituting policies where they will exclude the spouse if the spouse has an alternative for care, or some that may put a surcharge, if you will, on the spouse that has other coverage available. And so those that generally require an affidavit of some sort to say, whether you have other coverage or not. And if you do, you can come on. Oftentimes what we see the structure is, if you can come on the plan, but we'll surcharge you a spousal surcharge to come on the plan. There's a lot of different ways to structure it.
The Accountable Care Act does allow an employer to completely say spouses aren't eligible for benefits. But the Accountable Care Act says you still have to offer coverage to children. So spouses could be completely excluded, but children cannot.
That's good to know. I didn't realize that. Any other questions, comments, thoughts?
And for Kimberly's question, could you send us her email so we can respond?
You bet.
Okay, thank you.
And yeah, and if you all, after this, you have questions, I know Corey's contact information is on our website, or feel free to email Kelly, Aaron, or myself from the NAM team, and we can connect you to the appropriate person at FNIC. Well, with that, I think we'll move on to a few other topics.